Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today I'm discussing stem cell therapy for cerebral palsy in India. So I'm going to go through how common CP is, what are some of the causes and traditional treatments. Then we'll discuss stem cell therapy, look at some of the available research studies, and then talk about the R3 program in India. So around 10,000 babies are born each year with CP in the United States. The population of India is 4 times higher than it is in the US, so the math is over 40,000 babies in India. Recent population-based studies around the world show a prevalence of CP around 1 to about 4 per 1,000 live births. If you look at India specifically, it's 3 out of 1,000. That's similar to the United States, maybe a tiny bit higher. Risks include birthing at home, asphyxia at birth, being premature, low birth weight, having an intrauterine infection. Boys are diagnosed more often with CP than girls. It's the most commonly diagnosed childhood motor disability, not just in the United States, but in the world. Over half of children with CP can walk independently, and we can help with that. So what are the causes? Well, the brain damage that leads to CP can occur either before birth, during birth, within a month after birth, or during the first years of a child's life while the brain is still developing. Now, congenital CP occurs before or during birth. 80% is the percentage there. Acquired CP is brain damage occurs more than a month after birth. That's usually from an infection or some sort of head trauma. So what are the different types of CP? Spastic CP affects 80% of those with CP. It's increased muscle tone and spasm. Dyskinetic CP includes uncontrollable movements. Ataxic CP includes problems with balance and coordination. And a lot of kids with CP have something what's called mixed, which is, more than one of the above. Traditional treatments for CP, there are quite a few. Medications that can decrease the muscle spasms for spastic CP, and seizures. CP has a high collaboration with seizures disorders. So baclofen can help with the spasms, anticonvulsants with the seizures, Botox can help with spasms, stool softeners, sleep aids can be beneficial. And then at times surgery may become necessary. So to release contracture, because if you have a knee flexion contracture, it's very difficult to walk at all. Some surgeries can reduce spasticity, increase flexibility. So what are some alternative CP therapies? There's energy therapy, movement therapy, there's some mind and body techniques. Aquatherapy can actually be very helpful. And then as we're going to move into right now, stem cell therapy. So it's actually gone like this as far as popularity goes, because more research studies have come out showing its benefits. Our results have mirrored those research studies. Cross-matching and HLA typing is unnecessary with the umbilical cord stem cell therapies. We do know that cell counts are very important with stem cell therapy. A lot of the patients who come to us and have failed treatment elsewhere fail because they didn't get enough high-quality biologics. So the ones that are available would include autologous, which is bone marrow or fat, or the allogeneic, which is a donor, which could be umbilical or amniotic tissue. Currently, allogeneic with umbilical cord mesenchymal stem cells is most common. The larger research studies, that's what was used, so that's what's become more popular because the results are fantastic. All right, so let's look at some research studies. Stem cell interventions for people with CP. This was a meta-analysis where they took multiple studies, in this case 5, and they include the results and analyze them. Evidence of variable quality indicated a statistically significant intervention effect on gross motor skills. What's a gross motor skill? Well, ability to walk is a gross motor skill. Balance is a gross motor skill. Umbilical cord blood stem cells were most effective. Rare side effects and no immunosuppression was used. Here's a study from a few years ago, randomized, placebo-controlled human umbilical cord stem cells for CP. This was 54 patients. Half got stem cell therapy, the other half did not. So it was 27 patients. They got 4 infusions, I believe it was a month apart, with 50 million stem cells each infusion. So they did not do into the spinal cord. They did it just IV. So they got a total of 200 million stem cells, and the results showed that the stem cells plus basic rehab was safe, and it was very effective in improving gross motor and comprehensive functions in those with CP. Here's a study from quite a while ago. It was 8 children treated with umbilical cord stem cells. None of them had graft versus host reactions. We've never seen a graft versus host reaction. In fact, over the last 10 years, umbilical cord blood has become an actual treatment for graft versus host reactions. So 8 out of the 8 children showed some improvement in mobility and or cognitive function, and 6 of those children were rated as improving in muscle tone, hip movement, leg movement, rolling, balancing by the end of the 6-month follow-up. So very effective, very safe. I do want to point out that embryonic stem cells and induced pluripotent stem cells are not ready for prime time. They can cause tumors, they can cause rejection reactions. We don't use those. We use what's called adult stem cells from umbilical cord tissue that are very safe. They include mesenchymal stem cells and hematopoietic stem cells. That's what the research has shown to be safe and effective. We see the same thing. Our treatment program in India is in New Delhi. We've combined all the essentials for a first-rate program. We have expert clinicians. We have dedicated patient concierge reps who will help set you up with a free consultation. They'll help with the ground transportation, which is included from the airport to the hotel to the clinic. We offer very safe biologics that come from the United States with very high cell counts. Our labs incorporate FDA quality assurance program, which is very high and rigorous standards. And we do offer what I will say is the most cost-effective stem cell program in the world, by far. One of the things that separates R3 truly from the rest of stem cell clinics is our biologics quality. We've been doing this a long time, for over a decade, and 21,000 stem cell procedures globally in 6 countries. Our labs are accredited. They have a pristine safety record. We've never had a significant adverse event. Our quality assurance process is more rigorous than the FDA in the United States. We have 85% plus viability on our stem cells. We base the amount of cells on a patient's weight, so we want to make sure that patients do receive enough stem cells to get the best effective outcome. We do our procedures in New Delhi. The process starts with a free phone consultation. Your patient concierge representative will help get that set up and work with you on all the travel logistics. All international patients with their family receive a free trip to the Taj Mahal. If you'd like it, it's one of the 7 wonders of the world. It's about an hour and a half from our clinic. It is gorgeous. It's something you really need to see when you come. It looks like a postcard. It's incredible. It took 22 years to build and 22,000 workers. That's why we offer it, because it's absolutely incredible. All right, get the process started today. Visit us online at r3stemcell.com/India. There's a local number on the website, and then you can also call us at our regular headquarter number, which is +1 prefix for the United States, 888-988-0515. Thanks for joining me.